Okay. So we are live on YouTube. I will let Councilman Harper in when he comes, but I will call to order the Monday, July 6th, 2020 council meeting at 7:01 p.m. The first item on the agenda is a moment of meditation and silence. Would you please join me in the Pledge of Allegiance? Pledge allegiance
to the flag of the United States of America,
to the republic
for which it stands,
one
nation, under God, indivisible, with liberty and justice for all.
Thank you. Chelsea, would you call the roll, please?
Mr. Kelpie,
here,
Ms. West,
Here.
Mr. Moskin,
Yes.
Ms. Michael,
Yes.
Mr. Karras,
Here.
Ms. Wood,
Yes.
Mr. Harper.
And I haven't heard otherwise, but just in case, do we have a, oh, here's Matt. He's having technical difficulties, so he should be on shortly. So we'll hold on the motion to excuse him for now. We do have for approval tonight the regular city council meeting minutes, June 1st, and the special city council meetings minutes of June 15th, 2020. Were there any corrections, updates to those? Hearing none, do we have a motion to approve?
So move.
Second.
All in favor?
Aye.
Thank you. And Chelsea, just to confirm, do we have any communications?
No.
Okay. So we do have some delegations from the public today. So thank you for joining us on Zoom, virtually. But first up, we have Miss Betsy Rader, who is up for Ohio Senate District 18. And Miss Rader, let me see if I can spotlight you real quick. Okay, can everyone see her, or is it?
Yes.
No?
yes.
Yeah, okay. Well, Ms. Rader, I'll defer to you.
Hi, thank you so much for letting me join you tonight. These are interesting times to be campaigning and trying to meet people. Fortunately, I had met a lot of folks in Portage County before this all started. I wish I could spend more time with you in face-to-face contact. So I really appreciate being able to be with you tonight and to get to know you a little better. I invite you to call me anytime. My personal cell phone is 440-382-6474. You can go to my website, BetsyRader4ohio.com, and contact me through there. But tonight, I just wanted to talk to you for a few minutes. I live in Geauga County, Russell Township. The seat I am running for is an open seat. Senator Eklund is term limited, and it covers Lake County, parts of Lake County, parts of Geauga County, and all of Portage County. I live in Russell Township. My 3 kids went to the West Geauga Public Schools, but I was born actually down in Appalachian, Ohio. And my mom was a single mother of 4, grew up very poor. And fortunately, back then, you could work your way through Ohio State and, with part-time jobs, help pay your tuition. So I went to Ohio State. I graduated in 3 years and earned a full scholarship to Yale Law School. And I really wanted to be a lawyer because growing up, life was tough and people reached out and helped me. And, we had great public schools. We had ways that you could succeed no matter what circumstances you were born into. And so throughout my life, I have really tried to be an advocate for people. and have tried to pay it forward. And so like you, I have volunteered in my community. I served on the zoning commission. I served on the park commission. I've been on the Geauga United Way board, on the Geauga Park Foundation board, you know, a wide variety of community service. And I've also worked in a wide variety of roles where I've really had an opportunity to help my community. For instance, while I was an executive for a number of small businesses, I also served on the board of Cleveland Legal Aid, making sure that poor people had access to justice. I went on to work as the director of Geauga County's Guardian Ad Litem program for abused children. And I still work as a guardian ad litem helping abused children. I went on into the healthcare field and I became senior counsel at the Cleveland Clinic, went back and got graduate certification in healthcare policy, and went and worked at Medicare and Medicaid. And I worked with a lot of people in the public health field. I was mainly working to help design programs for people who are incredibly ill with diseases like end-stage renal disease, making sure that they had all the different services they need to get the most cost-effective quality care possible. And now I have my own law firm, and I represent victims of employment discrimination. I do civil rights law, and I help companies to follow the laws. And during this pandemic, I've been doing volunteer work all around the state of Ohio virtually, helping people to work through the problems we've had in our state unemployment system, trying to make ends meet during this pandemic. And I'm really glad that I decided to run for state senate this year, because everything that I've cared about my whole life, everything I've worked in my whole life seems most relevant to this incredible situation we find ourselves in. I think that as we come out of this pandemic, for instance, we recognize more than ever the importance of everyone having access to healthcare. And the fact that we need, for instance, to make sure that pre-existing conditions are covered, that we need to make sure people have access to affordable prescriptions. We have seen that without fundamental health, everything else falls. Everything rests on that. And so, you know, we've had things that we can do at the state level that have not been passed in our state legislature. And I feel like this is a real time when our state legislature can start putting aside the extremism, the polarization, and really focus on what matters to everyday people. You know, we can come through this together and be stronger for it, is what my hope is. Part of that's got to be investing in local communities and bringing resources back to our local governments and bringing resources back to our public schools so that they can provide fundamental services to our communities. And, you know, we have seen the shift going away from that in the past. I think this can be a real call to arms to make sure that we are bringing those resources back locally and respect the decision-making of local office holders such as yourself as to what's most important for your communities. And we've got to invest in infrastructure and things like broadband. And I hear that a lot down in Portage County, especially. Now we're moving to telecommuting, telehealth, teleeducation. We've got so many people who don't have access to things like basic broadband. This has been a real problem all along. But again, I hope that this is the sort of wake-up call that we've got to stop paying attention to the wealthy special interests who may not want to see some of these things happen, and we've got to do what's best for everyday people. And finally, a thing I'll really prioritize, because I think everything else rests on this, is we've got to have fair elections and fair districts. And people have to elect their representatives instead of their representatives choosing who's going to be their constituents. And so I will really fight against gerrymandering and fight for access to voting. And those will be my priorities. So I really appreciate you giving me to talk to. I'd love to hear from all of you about what your priorities are in your community. You know far better than I do. And so I hope we have those chances to talk in person.
appreciate your time tonight. Does anyone have any questions for Ms. Rader?
I just want to say thank you tonight for coming, Betsy, and thank you for coming and helping out the Times locally in our community with the food drives that we've been doing. So thank you.
No, I've really enjoyed that. Like I said, I wish we could be doing even more of it. So thank you. And is it all right if I stay on the meeting or should I exit now? I don't know what the.
I
You're
will
welcome.
take you off spotlight, but you can stay if you want to hear. Next, we have Bob Walker who's going to talk a little bit about the pandemic and what's going on there. But you're certainly welcome to stay. So
Thank you.
yeah. All right. Well, with that, as you can all see, Bob is sharing his screen. So our next delegation from the public is Bob Walker from the Portage Health District. I thought it was important to have him back and give us an update. So Bob, I will defer.
All right. Thank you. Can you hear me, Matt? Or Andrew? I'm sorry.
Hear ya.
All right. Well,
Hey,
thank
Bob,
you.
it looks like you're coming to us from the beautiful Rocking Horse Inn Bed and Breakfast. I recognize that background.
Thank you. Actually, I am. Thank you. All right. Well, thanks again for having me back. I will try to give you a brief update of what's been happening with the Ohio Department of Health as well as Portage County Health District. And at least in the last couple of weeks. As you may have heard or may know that testing has been opened up to all the priorities 1 through 5, and that's both symptomatic and asymptomatic, meaning no signs or symptoms. So any well-being person can actually go now and get a COVID test with or without a prescription, with or without symptoms. So that has been a big change in the last week or so with the Governor DeWine's order.
So where can you identify some of those places in Portage that people can go to get tested, or how that process might work?
Yes, tough question because we're working on it. So University Hospitals of Portage is testing all patients that are coming in for surgery or procedures. So they need to be negative within that 24-hour time frame that they're having procedures. The other one is that CVS and Kent is offering testing, though you have to have an appointment, it's my understanding. And then Access Point is also getting ready to offer testing, even though it's already up on the website that they are testing. They just don't have everything in place for a easy access. As you know, they're at Gallagher Avenue, and it's very tough to get into in and out of their parking area. So they're looking at some other resources. And I can share with you that one of the projects that Health Commissioner Joe Diorio for Portage Health District is actually looking at combining with a couple other stakeholders that are interested in doing a pop-up testing here in Portage County, as well as with the state of Ohio Department of Health. So stay tuned. We're hoping to hear in the next week of how those logistics might work out for pop-up testing. And again, that would require no prescriptive, and you don't have to be symptomatic to get those. So stay tuned for that. As you know, that's been a big change from months ago when it was only priorities 1 and 2, which was healthcare providers and safety forces, as well as anyone who was symptomatic and very sick. Those are the ones that were heading into our emergency department for specialized care and also our intensive care. So then it opened up specifically to healthcare and nursing homes and residents that were sick as well. But here in the last week, a couple of weeks, I say 2 weeks, I'd have to guess, that is opened up. So that's been grateful. We have more testing capability, and hence why that has opened up. The second thing I want to mention is Ohio National Guard has been activated with Governor DeWine, and one of the initiatives he gave them was to go out and do the long-term, or what we call skilled nursing facilities. So this would not be rehab centers or things of that sort where we have group homes where 4 or 5 people might live in a home. This is skilled nursing where the IVs are started. There's some kind of skilled nursing facility process. And we have 9 of those here in Portage County. And those have all been tested for staff only, and they've done some residents as well. So anytime we have a cluster, we have gone in and cluster tested. Cluster means 2 or more people having symptoms that are somehow connected to each other. For example, they might live in the same wing, or might be a staff member that took care of a patient that now has it as well. So those are called clusters. And so we do testing there as well. So that is opened up and that's been considerable help. And the goal of the initiative there is to make sure that non-symptomatic staff members are not coming in and exposing the clients. And what we have found for the most part, if healthcare providers are wearing their N95 mask and practicing all the precautions of PPE or personal protective equipment, the risk of transferring that has been very low. So we're grateful for that. We're also grateful for the testing to help at least minimize asymptomatic staff members that are coming in. I also just want to remind you, we talked about testing for the first couple of things that I mentioned, but I also want to mention that testing is a snapshot of what is going on today. It is not necessarily the best science yet. So we have approximately 70% accuracy with nasopharyngeal testing, and the intranasal is even less than that. So one of the things I just want to mention is snapshot of now. You also have to have a strong enough viral load in your sinus cavity for that test to pick up. So I might test negative today, but sometime tonight or tomorrow may test positive again, depending how fast that viral is growing. The average onset we're still finding is 5.5 days. It can be up to 16 days at the worst extreme that we have found with our contact tracing. But for the most part, it does occur 5.5 days after you've been exposed. With that, I'd like to move on then to the other thing is that's our personal protective equipment. We continue to maintain here in Portage County that we are in crisis mode. The main purpose of the crisis mode to identify that we still have shortages of certain personal protective equipment, mainly N95 masks, which is what we use for healthcare providers, including what we see with the fire and EMS services, and especially with the large. And we just found out that a couple of our squads here in Portage County have had back orders since March. So you can see that that's still a crisis mode. So we have to preserve our personal protective equipment and reuse them at times. And then gowns is the other one that we've had to reuse over and over until that they're soiled or start to tear. One of the reasons I push out that we continue to be in crisis mode so that all of us understand that we have to preserve and conserve our PPE for our fire EMS, for our law enforcement when they are involved, but also for our healthcare providers that will be taking care of you and I if we get sick enough to go into the hospital for care. And with the pop-up testing, I do want to mention too that we use FDA approved or Federal Drug Administration approved testing. So that's pretty important, especially as we hear false advertising out there of quick catch kits, anywhere from $20 to $50, and they're not FDA approved, so they don't give good science at all. And then I just want to point out, especially being a government agency, hopefully you guys are looking at the CARES Act and or the public assist with federal EMA. So hopefully your finances taking a look at that. And then I also want to talk about CDC or Centers for Disease Control has expanded their signs and symptoms. And I think that's where I was going to share this document of what we have. It's fairly new with our county. Of course, I'm not seeing that now. Are you guys seeing anything?
Nope, still the same public health advisory map.
Oh, do I have to do something more? Let's see. Oops.
Is that another photo within there?
Let's see, stop, rename. I think you had to assign me as presenter or something like that.
Yep.
I see a public health advisory system. Is that what you're talking about?
Yes, but I don't see it now.
Oh, I see it on mine. I just had to swipe my screen over.
I think I have to get rid of you guys. Move you off.
Yeah, I
can-
couldn't, I don't see you guys while I'm looking at it.
Yeah.
Okay.
So just swipe over, try that.
So are you seeing summary of alert indicators?
The
I
level is
am
1, 2, and 3, 1, 2, 3, and 4.
a public emergency. Yeah.
So at the top, it says risk level guidelines for the public.
No. Require compliance with all health orders. The different levels of emergency.
Do you see a map now?
Yep, map of the state of Ohio we're looking at.
Okay. You know, I think for the time frame, and I want to keep the meeting moving, let me just talk about some of the things that the expansion of the signs and symptoms for CDC has expanded. There's about 15 now signs and symptoms that CDC does recognize. We also recognize the disparity of our folks that are in our community, such as those who are homeless, those of color, and we also recognize that some of those are higher risk, and we have seen some of the deaths in Portage County. We have seen some disparity. We have higher death rates in Portage County with the Black community than we do throughout most of the United States. And so we have put out some information to try and educate them. Again, health disparity, as well as we do recognize that sickle cell also has an issue. And we're also, there's some science that is wondering if there's some genetic makeup. For example, Black folks have sickle cell, and we're recognizing that that might be an issue. So there's still yet science to be determined, but we do recognize that there are health disparities and that we do try to teach that out. And then we have talked about the multi-inflammatory syndrome or disease that you've heard about, Kawasaki, with children. And we are recognizing that COVID may be done and over with some patients, and only to return to the hospital or healthcare in the next following weeks with other symptoms, mainly because of this inflammatory disease that sets up in their body. So we're closely watching that to see how prognosis that is with our clients. And then I just want to point out that here globally in our world, we're at 11.5 million cases of COVID, and we're at 535 million deaths. In Ohio, we have 57,956 COVID patients, or has been diagnosed. And then we have 2,927 deaths. In Portage County, we have 433 COVID patients, or people that's been exposed, and we've had 58 deaths. That is one more death than what we had last week. And so 57 has been maintained for about a week and a half to 2 weeks. And prior to that, 56 was about another week. So as you can see, we've really plateaued here in Portage, and we're grateful for that because we don't want to lose any more loved ones. So then Governor DeWine came out with this public health advisory system, which is based upon a risk analysis. And as you can see, Portage County is yellow, and to our north is Geauga and Ashtabula. So that is the lowest level, which is level 1. And level 1 is active exposure and spread. And so what we do here is that we maintain good hygiene standards, including washing hands frequently, hand sanitizer, avoid touching your face, covering your sneeze and cough, wearing face masks in public, and avoid traveling to especially high risk areas. And we're maintaining good social distancing. So we're grateful that Portage County is steady and holding with several cases at the most per day or per week. So that's great news. And that is all based upon 10 alert indicators that causes those alertness. And I'm afraid to switch screens to show you the difference, but that's okay. You can, I'll forward this to your group and you can take a look at it. It's also on the Ohio website for coronavirus. And if you go to Portage County Health District website, there's also an interlink to the Ohio. So there's 53 counties in Ohio that are on level 1 public emergency. And level 2, we have 28. And as you can see from Portage, we have Summit, Stark, and Mahoning that are surrounding us. And again, so they're at higher risk. They are at level 2, increased exposure and spread that is occurring. And the reason I wanted to bring this up is because as government officials, I think that we need to start thinking of some of the things that we might do at these different levels. So one of the things that I did write down for level 1 is what you guys are already doing. You're doing virtual meetings. You're not allowing the public to come into your areas and spaces without appointments and that sort of thing. So for level 2, we have increased risk that is occurring in the area. And so the whole goal here in level 2 is awareness from the public to avoid contact with anyone who is considered high risk, such as what we had mentioned, those with COVID morbidity, such as cancer treatments, diabetes, overweight, that sort of thing, and lung problems, or heart problems. We also want to decrease in-person interactions outside the household, and we want to seek mental care if we need to. And we're very limited to going into healthcare areas that have high risk. Then the other one is level 3. And as you can see, we have a couple around us. We have Cuyahoga and Trumbull. And I just want to remind you that Trumbull does have a jail there. Cuyahoga, Franklin, and Cincinnati, Dayton area are the highest hotspots that are in Ohio, and a couple that are surrounding that. And again, most of those are specific to high congregate care settings, such as jail settings. And so we have 7 of those in Ohio, and level 3 is very high exposure and spread. We want to limit activities as much as possible, consider necessary traveling only, limiting gatherings of any numbers. And I already mentioned for level 2, you guys are doing more virtual, less person, even your rental inspections. One of your guys came out today, I want to thank him, mask. So he's protecting others, which is good that he's practicing that behavior. For level 3 though, you may want to consider perhaps not having any meeting in person, but they're all virtual. And I think some of those things you're already practicing. And the last, I want to talk about the level 4, which is the highest, and a star, which means that they are on the verge of going into level 4. And gratefully, only Franklin is the only county in Ohio that is near that. But a level 4 means severe exposure, spread. We would ask that you only leave your home for essential services such as medical supplies and food. Other than that, it was pretty much back to what we call that stay-at-home order. And maybe at the city government level, you would only do practicing of essential services, and most of your staff would be home, just like what we did at the stay home ordering. And then the last point I would just want to make is that the school sessions in the Ohio Department of Education and Ohio Department of Health has put out some documents, and Governor DeWine has announced that those schools will be back in session. And many schools have reached out to Portage County Health District for some guidance and some input, but they're pretty much 3 levels. One is all virtual, one is coming back completely all together, and somewhere in the middle is a 3rd one of a virtual / in-person. So with that, I thank you for having me back, and hopefully I've answered some questions of what's happening at the state and county level. And if I can answer any questions, I appreciate your time. Thank you.
Yeah, thanks, Bob, for coming in again and giving us an update. For me, has there been any feedback from the state or from either in the health department? You know, for us, we were just talking. I was talking with Christina earlier today on how long it's been since we've met in person, and we'd like to come out of this and meet in person. But has there been any conversations on not even council meetings, but just gatherings, period, on recommendations? Is it still 10 and under? Is that what we're looking at for the foreseeable future?
It is still 10 and under, as far as I know. The order still stands, and that was for mainly meetings in small areas. However, there's some exemptions that outline that, and there's the dine-in orders, and there's the graduation parties that can fall under the dine-in if you're having a graduation party with sitting dinner. The same thing with a wedding and church services. So there's some exemptions. But Governor DeWine has been very clear that as long as government officials can run their teleworking that we should continue that practice. And as you're doing with your Zoom and reaching out to the public through other virtual processes. So that is
Um,
the standing order that, as we're aware.
I do have a question, Bob. As far as our local restaurants that are here in Portage County, what type of guidelines does the health department have as far as them having to wear masks or not wearing masks? If it's a restaurant or a fast food establishment, is it required that the employees wear masks? And if it is, who is monitoring that? Like, whose responsibility is it to enforce that?
I do not have my notes with me from our Department of Operations Center, but we have over 1,000 complaints that come into our Portage County Health District since I think mid-March, like March 15th. And of those, then they escalate into, we make a phone call, we try to educate. And then out of those, if there's a repeat, so it's like anywhere from 2 or 3 times a complaint from the same restaurant or about the same restaurant, then our environmental health services goes out and inspects them and makes it an inspection. Again, process of education. We do have a few that we're going through the process of written letters to explain again. And then as far as I know, as of today, I don't know of any restaurants that are in a legal process because they've not complied. So the majority of them comply immediately, and many of them are out there trying to do the right thing. So the order for the state is that all employees have to be provided a mask. The only ones that are exempted are those who have a condition.
So that's something, it's,
In your background.
I know, I'm sorry.
So there
I couldn't hit the mute in time. It goes around here at the same time every night. So, but yeah, I just wondered, so that's not something that our city would be enforcing. That's more or less from the state, from more of a health health, district standards than it would be us as a city. So I think there might've been some question with some residents on that if they, have seen some restaurants that might, their employees might not be wearing masks. So that's something that we can pass on if we get a phone call that they need to contact or us to contact the health department, correct?
So clarification, the governor's order is that all employees need to be wearing masks unless they have a health condition. And then any complaints would be filed with the local health departments.
Right.
Here
Thank
in
you.
Portage County, that's us. Unless you're in Kent City, then it goes to the Kent Health Department. But
Okay.
both of us are enforcing that through Portage County.
And Bob, I want to say thank you and the health department. I know every time when I'm around the health department, you're there. And I know you're working countless hours along with your other employees. And, you guys are doing a great job and doing the best you can with what knowledge that you guys, everybody's learning right now. So unfortunately, there's no perfect answer out there, but you are putting 150% into this. And, thank you, because you're making a huge difference in our community.
Well, thank you for sharing that, but also I want to share to the council as well as other government officials that's trying to do the right thing in education and inviting us and helping calm those rumors down. So thank you.
Yeah. Mm-hmm.
I have a question for you, Mr. Walker.
There you are.
So before tonight's meeting, I noticed there was an article in the Courier about cities either adopting or considering the adoption of requiring masks. Cleveland area has done it. Akron, I believe, is considering it unless they've already done it. But is there a connection between what you presented as these 4 levels and the point at which local municipalities like ours should start considering, ordinances, laws, and enforcing those laws to make sure everyone's wearing a mask in public? In your opinion, at what point do we start considering that?
Sure. So I would invite your council to consider what steps you would do at each level. And so instead of waiting till that level occurred, you may want to process what those steps would be and to put into your city ordinances what those would be. So perhaps level 4 would be that everyone would need to wear a mask in the public. That's the highest level, and that's the very high concern. I don't know if other cities are adopting that yet, because this just came off the press last week. I really like this, and several other states have adopted a very similar process because it uses a risk assessment that is based upon the community needs. It's not based upon the state, it's based upon Portage County and Ravenna City. So some of the input that we would have as these levels change is our government officials. How are they feeling? That's where our EMA, Emergency Operations Center, comes in place. We have combined Department Operations Center meetings so that we're all on the same page. For example, the crisis PPE. So I believe that this will become conversation over the next couple of weeks of how we as the DOC and EOC will start to operate so that we can be ahead of the curve. So when we hit level 3 or 4, we can say masks are required in these communities. So I would invite you to think about what that might mean for Ravenna City before you get there. And hopefully we never have to get there. So good planning and maybe not use it at all.
Yeah, that was going to be my follow-up to Rob's question was, has there been any indication that cases here in Portage County are rising, or specifically in Ravenna? And how has that interface been between the health department and the mayor's administration on communicating whether cases are rising or not? Is that strictly through the JIC that's coming out through either the DOC or EMA, or how's that process worked?
The JIC is the Joint Information Center, so that would not be the process, I don't believe. But the mayor's committee or group, I'm not familiar with them. But to answer your question, Portage County would be using as many legal processes that we possibly could. I know Portage County commissioners have talked about it, and what we're hearing from Ohio Department of Health conversations once a week is that county governments cannot implement this. It has to either come from the state or it has to come from city villages that has the administrative process to mandate within their community what they can do. So I don't know if that helped answer your question.
I think on my end, I just don't want to implement something when you're saying we're not getting don't implement until level 4 when we're at level 1. But incrementally, we don't want to be planning, as the plane is taking off, to use, I guess, that analogy. But I'm just questioning how do we know, outside of what we're hearing, through the public or through Governor DeWine, how many cases are being reported in Portage County? Does that go down to the state, and then we just tune in every day at 2 o'clock to hear updates from him? Or is there other ways that we hear this, or the city might hear it through the health department?
The information is updated every Wednesday on the website for Ohio Department of Health, and that's where we send our numbers to. We do have stakeholders that are involved with our DOC, Unified DOC, and EOC. So I think I might want to reach out to Ryan, our EMA director of Portage County, and ask how that process might work so that we're not waiting to that phone call to every single mayor saying, hey, we're on level 3. Are you ready to implement some of your plans? I would hope that there would be planning for each level, not waiting for just 1 or 4, but also in between. But you bring up a good point. I'm not sure how that communication will occur. And I'm not sure the Governor DeWine's office has been very clear of how we implement feedback through our government officials other than the county commissioners. So I think it's pretty important that we recognize that we also have villages and mayors and township trustees. So thank you for bringing that point up.
No, I appreciate you being open about it. We get questions, or I get questions quite a bit on where we are, how many cases we have, how many deaths, all those updates. I just never seem to know if it's truly up to date or how we go about getting those numbers. But pointing, I think, the public to the website and keeping an eye on that is a good point.
Thank you.
Anyone else have any questions for Mr. Walker? Okay.
Well, thank you for having me back. I appreciate your time.
No, thank you. Thank you for coming.
Thank you, Mr. Walker.
All right. I'll buzz out.
Well, that is the last delegation from the public. So the next item that we have on the agenda for this evening is the report of officials. You should have received Chief Wallace's report via email, and we're in the process of getting Chief Chappell's report to you as well. But let's talk about Wallace's. Was there any questions on that? And if there are none, is there a motion to accept the report of officials?
Move to accept the reports.
Second, yeah,
Thank you, Amy. All in favor?
aye.
Aye.
The next item on the agenda is report of committees. The committees will be next Monday, starting at 5:30. So that's July 13th. The first one is utilities, Mr. Moskin.
Muted.
He's muted.
Yeah, I'm trying to unmute you, Paul. There you go.
Okay. Do you want me to, do I need to repeat that?
Yes, please.
Okay, yes, I will. There will be one thing next week, and that will be for the water meter replacement project. And at that time, well, probably today or tomorrow, Mike Reynolds will have all the facts that will be presented. And if I can contact him tomorrow and to have those sent to each of you if you would like.
That'd be great. All right. Thanks, Paul.
You're welcome.
Next is information systems, Ms. Wood.
Yes, we will have at least one, which would be the IP contract, as well as continued discussions, probably for the cameras.
Okay. Thanks. Next, planning, Mr. Karras.
No items on the agenda tonight, but we will be a meeting next week.
Thanks. Next, committee of the whole will be on Monday, July 20th at 7 o'clock. Next is public health and safety, Ms. Michael.
Yes, we will have an item tonight, and we've been talking about having a couple items for the next meeting, and I'm asking that if I'm able to get the person I would like to attend our meeting, I would like to have us first on the agenda at 5:30. If I could have the 5:30 spot,
Yeah.
if she's going to be able to attend.
Yep. Okay.
Because we have some things that I think we talked about, and Andrew and I just I think it's important that I get this individual to come to our meeting.
Whatever time works for. So.
Yes.
Yeah. Okay. Next is streets and sidewalks, Mr. Harper.
I have 3 items for consideration this evening. I have not heard of anything for committee next week, but I'm sure if there is, we will schedule a meeting.
Okay. All right. Next is personnel.
Hold
Oh.
Wait, Harper. Actually, there is gonna you're gonna need that ordeal on Main Street that I had been that problem that we've had with the street on West Main Street that I had sent the email about, where the house owner was going to be here, and we're hoping to get some information from Mr. Finney. I don't know if you remember seeing that email, but I talked with the mayor about it and Kay, because I had received the complaint, and I had sent the email out to you and Andrew about bringing this to committee, because it has been an ongoing problem, and it's kind of been left in limbo because we're not really sure what's going on and who's liable for it. So you will have that item on your agenda.
Yeah, it was my understanding that Finney was very involved in that, and at
Right.
that time I was told that there was no liability on the cities. At that time, no liability on the city from Mr. Finney. So
We don't-
if it needs addressed, we will address it.
Yeah, because at this point, we really don't know. There's kind of conflicting sides there. So, and Bob did not have all the information yet. He needed to compile all of that. Mr. Seaman is aware of the situation, and so is Kay.
Very well. Thanks.
Okay, yep.
All right. Personnel, Mr. Calfee?
Nothing for personnel on the agenda tonight, and no plan for a meeting on the 13th.
Next is Community and Economic Development, Ms. West.
Nothing that I'm aware of as far as for next week, but if something comes up, we'll schedule a meeting.
And then last is Cemetery, Mr. Harper or Mr. Moskin, do you want?
Yeah, we had our meeting last week. I'll start out. You can jump in. We met with the architect last week in regard to the Schaefer Foundation and the donation. We're still receiving a lot of in-kind work and dirt to level out the one back section that's being developed with the pond and some other possibilities. So we're still moving on that. There's still some decisions to be made that we're working through right now with the architect, but things are moving forward with that.
I have nothing else to add at this time.
Okay. Thanks. And I think there'll be some discussion next week. So, yeah. Well, with that, we'll move on to first reading of ordinances. The first ordinance on the agenda is ordinance number 2020-63.
An ordinance to appropriate $12,000 from Capital Improvement Fund 65-74 for the purchase of various sizes of fire hoses for the fire department and declaring.
This is sponsored by Public Health and Safety, Ms. Michael or Chief Chappell, if you'd like to speak to it.
Hi, Chief Chappell. Are you there?
I am.
Okay.
I got you on voice, but not video, because I'm responding to the station. They have a medical call in Charlestown, and the station's in. So, but so you got me on voice, but no video.
That's fine. So is this the amount that we are still going to appropriate? Has there been any changes?
No. We ended up finishing our hose testing in the end of June. We ended up with 56 pieces of hose, sections of hose that we had to take out of service because they were 1987 or older. And we were having to take the hose out of service based on its age through NFPA's recommendation along with BWC's mandate on it. And the way BWC is involved in it is if an individual was to get hurt or reported hurt because of a hose breakage or any kind of issue, we could be cited through PERP, which is Public Employees Risk Reduction Program, up into like 50% of whatever the injury cost. Plus, it could also jeopardize our possibilities of getting the BWC grants.
Okay. Anybody have any additional questions on this?
Hearing none, do we have a motion to waive the 3 separate readings?
So moved. Second.
Ms. Wood,
Yes.
Ms. Michael,
Yes.
Mr. Kelfie,
Yes.
Ms. West,
Yes.
Mr. Moskin,
Yes.
Mr. Karas,
Yes.
Mr. Harper.
Yes.
And a motion to adopt the emergency clause?
So moved.
Second.
Who was that?
Yep. I missed that. I'm sorry.
Cheryl and Amy.
Cheryl and Amy. Thank you.
Ms. Wood,
Yes.
Ms. Michael,
Yes.
Mr. Kelfie,
Yes.
Ms. West,
Yes.
Mr. Moskin,
Yes.
Mr. Karas,
Yes.
Mr. Harper.
Yes.
And a motion to pass.
So moved.
Second,
Mr. Harper,
Yes.
Ms. West,
yes.
Mr. Kelfi,
Yes.
Mr. Moskin,
yes,
Ms. Michael,
Yes.
Mr. Karas,
Yes.
Ms. Wood.
Yes.
All right, that ordinance is adopted. The next item on the agenda is ordinance number 2020-64.
An ordinance authorizing the mayor upon the approval of the Ohio Public Works Commission, OPWC grant of $248,500 and loan of $50,000 to enter into the necessary contracts, including the contract, the Lawrence Street Waterline and Sidewalk Project, CG 09X/CG10X, and declaring an emergency.
Thank you. This was sponsored by Streets and Sidewalks. Mr. Harper?
Yeah, this is passing the ordinance. The state has not released the grant funds to my knowledge. But when they do, this passage of this ordinance will allow us to get started sooner than later.
Any questions there? Hearing none, do we have a motion to waive the 3 separate readings?
So moved.
Second,
Ms. Michael,
Yes.
Ms. West,
yes.
Mr. Kelfi,
Yes.
Mr. Moskin,
yes,
Mr. Karas,
Yes.
Ms. Wood,
Yes.
Mr. Harper.
Yes.
And a motion to adopt the emergency clause?
Motion. Calfee.
Second.
Mr. Kelfi,
Yes.
Mr. Moskin,
yes,
Ms. West,
Yes.
Ms. Michael,
Yes.
Mr. Karas,
Yes.
Ms. Wood,
Yes.
Mr. Harper.
Yes.
And finally, a motion to pass.
Yes, Amy.
Second.
Ms. Michael,
Yes.
Mr. Harper,
Yes.
Mr. Kelfi,
Yes.
Ms. West,
Yes.
Mr. Moskin,
yes,
Mr. Karas,
Yes.
Ms. Wood.
Yes.
The third item on the agenda is ordinance number 2020-65.
An ordinance amending the codified ordinances of the city of Ravenna, Title 8, Parking, Chapter 452, Parking Generally, Section 452.21, Prohibited and Restricted Parking Areas, Subsection A, by prohibiting parking on both sides of Highland Avenue between Vine Street and Diamond Street at all times.
And this is sponsored by Streets and Sidewalks. Mr. Harper?
Yeah, we discussed this quite a bit. Just to clarify, this is on-street parking. There is an ordinance on the books for tree lawn parking, which was a concern of some of the residents in the area. So this will ban the on-street parking to help possible congestion on a busy road.
And this will require a public hearing. So this will stay here for second reading, and we will schedule that public hearing. And like Matt was talking about, we'll probably have further conversation about tree lawn parking next week during committee meetings and how that might be enforced in the future. So that'll stay here. The next item on the agenda is ordinance number 2020-66.
An ordinance authorizing the mayor to enter into contract with JD Services for the painting of pavement markings and striping and declaring an emergency.
Thanks. And that's sponsored by Streets and Sidewalks. Mr. Harper?
Yeah, that's pretty straightforward. We've discussed this, and unless there's any additional concerns, we'll go ahead and move this forward as well, or pass this as well.
No questions? Hearing none. Do we have a motion to waive the 3 separate readings?
So moved.
second,
Mr. Harper,
Yes.
Mr. Moskin,
yes,
Mr. Kelfi,
Yes.
Ms. West,
Yes.
Ms. Michael,
Yes.
Mr. Karas,
Yes.
Ms. Wood.
Yes.
Do we have a motion to adopt the emergency clause?
So moved.
Second.
Second Calfee.
Ms. Michael,
Yes.
Mr. Kelly,
Yes.
Ms. West,
Yes.
Mr. Moskin,
Yes.
Mr. Karas,
Yes.
Ms. Wood,
Yes.
Mr. Harper.
Yes.
And lastly, do we have a motion to pass the ordinance?
So moved.
Second.
Ms. Michael,
Yes.
Mr. Moskin,
Yes.
Mr. Kelly,
Yes.
Ms. West,
Yes.
Mr. Karas,
Yes.
Ms. Wood,
Yes.
Mr. Harper.
Yes.
Thank you. That ordinance is adopted. The next item on the agenda is ordinance number 2020-67.
An ordinance appropriating an amount not to exceed $4,000 from Fund 553 for the purchase of cameras, software, and installation as listed below, per the recommendation of Quality IP and declaring an emergency.
Thank you. And this was sponsored by Information Systems. Ms. West, or excuse me, Ms. Wood. I'm sorry.
It's quite okay. It's a compliment. We've discussed this thoroughly, and as you can see, the numbers have come way down from the original quotes that we received, thanks to the due diligence of Mr. Kalugi. And so we would like to move forward with getting the equipment and cameras, especially since we do not know how much longer we're going to continue the video and conference meetings. And if things get worse before they get better, it can only help us.
And I talked to Cheryl about this. So the timeline on this is purchase now and then installation hopefully by the end of July. So regardless of what happens, we have the system up and in place to use even right now. So it would replace our Zoom calls and we'd be able to use that, and it would all be controlled. Over here, it would be hardwired. I know things are going, I don't want to jinx it, but they're going okay tonight, but there would be no internet issues or anything like that. So yeah.
There's still time.
Knock on wood. Is there any questions regarding that? Because I know there's not really there's a tracking sheet, but in your attachments in the exhibits, this is a little different since we're going outside of the quote to make these purchases. Okay.
Nope. I'm all for it.
Okay.
So
With that, do we have a motion to waive the 3 separate readings?
so moved.
Second.
Ms. Michael,
Yes.
Mr. Moskin,
Yes.
Mr. Kelly,
Yes.
Hey, can you guys hear me?
Yes.
Okay, I just checking.
Ms. West,
Yes.
Mr. Karas,
Yes.
Ms. Wood,
Yes.
Mr. Harper.
Yes.
Do we have a motion to adopt the emergency clause?
So moved.
Second.
Mr. Harper,
Yes.
Mr. Moskin,
Yes.
Mr. Kelly,
Yes.
Ms. West,
Yes.
Ms. Michael,
Yes.
Mr. Karas,
Yes.
Ms. Wood,
Yes.
And finally, a motion to pass the ordinance.
So moved.
Second.
Ms. Michael,
Yes.
Ms. Wood,
Yes.
Mr. Kelly,
Yes.
Ms. West,
Yes.
Mr. Moskin,
Yes.
Mr. Karas,
Yes.
Mr. Harper.
Yes.
Thank you. I apologize, Rob, for the yellow boxes to appear. So that ordinance is adopted. The next item on the agenda is ordinance number 2020-68.
An ordinance to appropriate the sum of $34,000 for the cleanout of debris from the interior of the Tantamonia City Park Water Tower and painting as needed and declaring an emergency.
Yes, I was wondering if everyone had received the information that Mr. Stevens had sent out earlier today.
Yes.
The reason I'm asking that gave a lot of detail pertaining to the procedure of this project. This project is to be started shortly after it's approved by council.
Well, is there any questions on that? I'm not too sure that Paul or I could answer these questions, but you have the contracts in front of you with all the information.
Well, what we have are, I'm not sure what they are. I guess they're sort of quotes. Thing that confuses, the painting is an hourly thing, it looks like, and we didn't
Yes.
until very late, so I may not be reading all this correctly. So it doesn't tell us how much hours it's going to be, so that seems to be open-ended. But more, at least problematic for me, is the quote from the Pittsburgh Tank Tower Group, because what it does is it lists a laundry list of things, X's that company has determined to be the critical, maintenance. I don't know. There's a bunch of categories, but there's no adding up. Did I miss something, or how did we arrive at 34,000? Because it doesn't seem, the documentation does not seem to identify what the specific work will be and how much it's going to cost.
I agree.
Well, part of that goes by, it will be determined after the diver is inside the tank and gets a much better look at it to analyze that as they go on once the project is started. So it's possible it could be less than that, but it will not exceed that.
Paul, some of the items that were on that said they were required by code, which that made sense, but then some of them were just preventative measure, or, so how do we know when, so a lot of that's already outside of the tank. How do we know if those are going to be done? Because that would be built into the estimate as well. Is that what you were asking, Rob?
Yeah, I don't know exactly what work it constitutes waiting and seeing and what we're just going to do. There's such a long list, and I don't know. I mean, I'm not even sure I know exactly. Some of them have check marks in 2 different categories.
Right.
And this is just from the vendor. What it seems, and the vendor says at some point, let us know which work you want to do, but at no point in the documentation does it like describe what they want to have done.
Okay, Mr.
So-
Stevens will be on site when that's started, whenever it's approved. And he will be not just on the ground, but inside of a vehicle, seeing what the divers are doing inside the tank with the pictures that are sent down into a vehicle. And he'll be there on
Overseeing it.
Yes, and making decisions for the pictures that are sent down into the vehicle for what is seen. And that's what will come into play of what's going to be most critical and not. That comes into play with why there aren't exact specifics and why certain things aren't extremely critical until they are actually in the tank.
If I could jump in real quick. So I asked Tim for the contract or the quote, and I want to read what he wrote because I think it answers some questions. My understanding is this is a not to exceed $34,000. So I want to read this real quick. What Mr. Stevens says is the interior cleaning is a flat fee. The repair work to be completed on an hourly basis /hour, or basis cost, /hour. Again, the repairs are as needed. Once we see what is needed after cleaning, some areas inside I know need attention from the recent inspection, which I have attached. Keep in mind, there are some areas on the outside that need touched up, which you can see in the attached inspection report. The intention is to also use some of the funds for the exterior touch-up. This will be done with a painting contractor that will be doing the power washing of the exterior. If we were to do everything that is called out in the attached report, it would be very expensive. I'm just trying to fix a few critical items at this time.
Okay.
So that's the language I received from Mr. Stevens earlier.
Yeah, I read that. It was in your email.
Yeah, okay. I just wanted to read it.
Let me give you an example though. And like I said, there is a laundry list of things. Says the third item, electrically ground the tank, $1,250. Are we doing that? It's not something you have to wait for until you inspect the tank, right? Install frost-proof drain valve. No, maybe that is something, I don't know. Install.
That's all, isn't that stuff all of like what Tim's expertise is as far as what he comes out to, that we actually need to get done, you know, whatever the high, I can't even talk straight, sorry, I worked last night. Isn't this all stuff that could be fixed, but it all determines on what are the necessities? These are all things that are the prices, so we're not sure which is going to be fixed, but at the end, you know, once the job is completed, I'm sure we'll get a list of what of these expenses, you know, were in that cost. Am I right? Or
Yes, you are correct.
But I think
okay,
confusion is coming in because the way that it's written out, you have critical deficiencies, non-critical deficiencies, OSHA, the structural issues, and preventative maintenance. And then you have the laundry list of items that have different quotes by them. Well, if a large number of these need done, it's certainly going to exceed the 34,000.
No, it'll stop at that. If it
Yeah, we're
goes
not
to
gonna
there,
go
it'll
anymore.
stop right at the 34. Even if there are other things that need to be done,
So they're
he
going
will
to throw them
help.
in for free.
Pardon?
So they're going to throw them in for free.
no, they're going to
No.
only do the most important things that they see when they go in there to do.
That's what the question, I guess that's where I think Rob's question was, you know, what's being determined is into this 34,000. How do we know that the absolute most important things can be taken care of for the 34,000? What if there's something else that's detrimental that needs to be taken care of that they're not sure at this point? So then it could exceed that.
Well, Tim's done this
No,
before in the
it will not.
past.
It-
I mean, this
yeah.
was done how many years ago? It was like one of the first few terms that I was on council, and Tim did do this on our water tank, and you know, he did a good job. I guess I don't want to overthink this process on his expertise. The amount that we're appropriating is what we're appropriating, and we're not going to exceed that, and it's up to him to determine, because this is what his degree's in, you know? So this is what I think we're overthinking it. That's just my opinion.
But you are correct. It will not exceed the 34. And it could be less depending on what they
Right.
see once they're in the tank.
Mr. Mayor, is there anything
I'm not
that you can add
questioning
to?
anybody's expertise. I'm not questioning what work needs to be done. I'm just questioning how this documentation was prepared for us to review, because we're just, as far as I can tell, if we vote on this tonight, we're voting to authorize $34,000, and I really don't have much of a clue what it's going to go for. Because all those things on that list, I don't know what they mean. I don't know what's critical, even though there's categories. And I don't know what our expert, other than that what Andrew read from the email, which isn't real specific, which mostly talks about painting and stuff. But I mean, I feel uncomfortable that I just don't know what exactly that $34,000 is for. And then I do get a little nervous, like, well, what if they find out it needs a lot more than 34,000 and we just stop the work? Is that the prudent approach this either?
Okay.
So, I don't know. I guess I'll defer to how other people feel, but I'm a little concerned about the lack of specificity in how this has been presented.
I'll say two.
Okay.
Real quick, I want to say
What
two things.
if,
Paul, I want to say two things real quick. The first
Okay.
is it's up to council. So if everyone's comfortable with voting on it tonight, we could do that. If not, then we most likely will have a special this month to approve some other things that are coming up. So that is another avenue that we could take and get clarification from Mr. Stevens if that's what we choose. But I also want to ask the mayor, is there anything that you can add to this in terms of detail as to, is this an emergency? Can this hold off? Can it at least be left on for a second reading so we can have more information?
The water tower is a critical part of the water system. It creates the pressure in a lot of places. Tim is very methodical in what he does. I honestly, this happened while I was on vacation, so I have not seen what you've done. The only thing I do know that if he put this in there, there's a reason for it.
Absolutely.
And as you should know, I logged off for a few minutes because I had a phone call. They're out now looking for a leak because we're showing at the water plant that we're losing water someplace. So they are out chasing down a leak. So we've got this hot weather. But I think part of the deal with this is there's a narrow window as far as construction goes and these types of things in the summertime. But I can't speak with authority about this, although I have a lot of faith in Mr. Stevens knowing what he's doing. And I think that if they find other work that needs to be done that's going to exceed that, obviously they've got to come back to council. But I get the sense, just from what I've heard and what I'm listening to, is that there's a need to do this so we can maintain our water system. With that, I don't have a problem if you want to do a special, and we'll get a more detailed thing from him on that. But at the current time, when I saw this on there, it's on there for a reason. You recall that we did the other tank that's out off of Route 14. And cleaned that. Is Mr. Finney with us tonight? Did he sign in?
No, he's not.
He did not? Okay, because he could shed some light on this situation. But I don't know if they ever filled the tank out there. At
the old GE.
Yes.
Yeah, that has been filled in the past years.
Yeah, but it was left empty after they repaired it the last time. But I think they have put water in it since recently out there, and that could have been because it may help offset the work while they're working on this one in terms of water pressure. But I'm guessing at that. Rob, I'm like you, I don't have any more information than you do. And I would like to talk to Tim, but I know Tim is very busy right now trying to find that leak before it gets dark.
Well, I'm going to make a suggestion then for just anyone that would like more information. I want you to make the best decision. And because I'm saying that, if you'd want to have Mr. Stevens involved in a meeting to make, to give better answers and more clarification.
Before that too, I don't mean to butt in, Paul. We've heard from 4 members of council. I'd like to get the opinions of the other members too on this piece of legislation. If we take it up for a vote tonight, right now it seems to be a split.
Yes.
Take a guesstimate, but I'd like to take into consideration the other members as well.
Yes, that's important.
I would just say that I did receive it this afternoon and read through the entire report. And at the end of the time, I tried to do the same matching that has been discussed about what was going to be the $34,000. As I read through many of the things, there's prices on lots of them. And I didn't see one that just said painting $34,000 or miscellaneous repairs $34,000. And so I had the same question. And so that was my only confusion. I think if it would said, here's what it's going to be, $34,000 for painting hourly basis up to this many hours and this and that. That was my thought. I did not know what we were approving for. That was my thought.
Well, it's unsure how much paint will be used depending on how bad the places are inside.
Right. I mean, I could vote for it. I trust them, but that was the only question that came up.
Now, I want you to be comfortable whichever way you decide.
Mr. Harper or West, is there any, you have any thoughts on the
I'm
ordinance?
okay with it. There are a few concerns. I'd like to see maybe a little bit more of a priority list. Designated, this is our top priority. This is what we're gonna do first. If we have money, this is what we're gonna do second. But I think with Tim involved, the most critical issues will be addressed first and foremost. So at this point, I'm okay with moving forward with it. And
Well, Ms. West, anything to add on your end?
Kind of, which is Mr. Harper just said, I think not knowing the priorities because the vendor is listing the priorities instead of Mr. Stevens listing the priorities. That was my thing, is the vendor is saying this is what's important and not, getting a clear picture of what he wanted to do. That was my question. So
I guess my concern would be, I don't want to see him spend $20,000 painting the outside and say, oh wait, we need another 40 to address the inside.
Well,
And I
the,
don't think
Possibly be
Tim-
the critical,
yeah.
the main concerns with the.
I don't see him allowing that to happen.
I don't see Tim allowing that.
And I don't think it'll happen either, but those are some
But it's a
concerns
concern.
when it's not, put out there for us. People have different views on things.
well,
So
there's 16,000 already set aside for the exterior, for the power washing and those types of prepping.
and that's being done by a different company and that has nothing to do with this quote, correct?
Yeah, that's different than the inside.
So the quote that we're looking at is the inside
30.
and other equipment that needs to be done, but that doesn't include the power washing, which is not going to get done till later.
Well, it won't be much later. It'll be similar time span. But that's already taken account for financially.
Sure. He was said late summer, early fall for the interior work is what he had asked, because I had asked about it. And then after that for the power washing.
And again, on my end, just to give my 2 cents, knowing Tim well enough, I'm comfortable moving this forward, as him being the subject matter expert for a long time. That's just on my end, but the question still remains, is council comfortable with making a motion to bring this to a vote? Or would you rather wait for a special later in the month? Again, that's probably not going to be till the end of July.
I'm comfortable with bringing this to a vote. I just wish that for future references, that instead of giving us up to 34,000 with a laundry list of items, maybe it could say, for up to 34,000, this is what would be included. Anything beyond this is going to be additional. I think the prioritizing for our sakes, because we're not the experts in that field, but I do trust our expert. I think since we are handling the financials on it, we do need a little bit clearer of a quote.
And I appreciate the conversation tonight too.
I think that's a really good point. The only other point I'd make, and this is not unique to this discussion, if you look at the date on the quote for, the more complicated aspects of this work, it was dated on June 5th. I had over a month to discuss this in committees, and we get it the day that we're voting on it. That's as critical a problem as not having, the specifics about what's the priority and what we were spending our money on. So I think if nothing else, I think we just need, I agree. I don't want to question anybody's expertise or any, I'm not saying there's anything wrong with it. I just wish we had better information and I wish we had more time to review it. Because I think what we do, it's our responsibility. Everyone who's about to vote, we're the ones empowered to make these decisions and spend the money. And we need the right information before we make those decisions. And if we're always just going to defer to people, then what's our role here? We're not a rubber stamp. We have to be informed, and maybe we're not as informed as we always should be. Some of these things are legal issues. Some of these things are very technical, like this. And I'm not an expert. I'm not questioning that aspect of it. I just would feel more comfortable. I'm prepared to vote on this tonight and approve it, but I would feel more comfortable going forward. When the information comes in, it gets forwarded to us as soon as possible. If appropriate, we could have asked Tim to come to a meeting and talk to him. But instead, it's a last minute thing and we have to get it done. And that just makes me feel uncomfortable. So again, I don't want to make it sound like I'm questioning anybody's motives or expertise or anything like that. I just want to feel more prepared and comfortable when I make a decision.
The only reason it was that you received it so late, he just received it at the end of last week. He had forwarded it.
It says June 5th on the document. Man, unless I'm reading it wrong, it's
PTT, yeah, the PTTG document. The Midco one was dated July 1st, so that Paul is referring to. But with that and hearing consensus, it sounds like, do we have a motion to waive the 3 separate readings if there's no other questions?
Well, if they want to wait and get more clarification to make a better decision.
I have no problem, pushing this through, and I don't want it to hold up. I'm concerned that this is going to cause problems with the safety of our water. So, and it's important that we stay on top of this. And who knows how long it could, if this person, they could have a time schedule where it's so long, they have to do work like this in this type of weather. So, I'm trusting, because I've been through this before, this process, that I'm okay and I'm comfortable with moving this forward.
Sounds like a first.
Second.
Yep.
Thank you.
the longest first in history.
Ms. Michael,
Yes.
Ms. West,
Yes.
Mr. Kelfi,
Yes.
Mr. Moskin,
Yes.
Mr. Karas,
Yes.
Ms. Wood,
Yes.
Mr. Harper.
Yes.
And do we have a motion to adopt the emergency clause?
So moved.
Second.
Ms. Michael,
Yes.
Mr. Moskin,
Yes.
Mr. Kelfi,
Yes.
Ms. West,
Yes.
Mr. Karas,
Yes.
Ms. Wood,
Yes.
Mr. Harper.
Yes.
And then finally, do we have a motion to pass the ordinance?
So moved.
Second.
Mr. Harper,
Yes.
Mr. Moskin,
Yes.
Mr. Kelfi,
Yes.
Ms. West,
Yes.
Ms. Michael,
Yes.
Mr. Karas,
Yes.
Ms. Wood.
I'm starting to lose battery power. So if for some reason I disappear, it means I'm dead.
Well, I got
Literally.
Don't put it down.
So that ordinance is adopted. The next item on the agenda is ordinance number 2020-69.
An ordinance approving the transfers and advances for the month of May 2020 listed on Exhibit A attached here too and declaring an emergency.
This is sponsored by our finance director, Mr. Huff.
Yes, so these are standard transfers that we make every year. These ones in particular are for our semi-annual debt payments that are coming due. I think one of them was the Honeywell project, which I'm hoping to bring that to council soon to get that refinanced. But more to come on that, so we can take advantage of some of these interest rates. But that's all that is.
All right, well, any questions for Mr. Huff? Hearing none, do we have a motion to waive the 3 separate readings?
So moved.
Second.
Alfie.
Ms. Michael,
Yes.
Mr. Kelfi,
Yes.
Ms. West,
Yes.
Mr. Moskin,
Yes.
Mr. Karas,
Yes.
Ms. Wood,
Yes.
Mr. Harper.
Yes.
And a motion to adopt the emergency clause?
So moved.
Second.
Ms. West,
Yes.
Mr. Kelfi,
Yes.
Mr. Moskin,
Yes.
Ms. Michael,
Yes.
Mr. Karas,
Yes.
Ms. Wood,
Yes.
Mr. Harper.
Yes.
And then finally, a motion to pass the ordinance.
So moved.
Second.
Second.
Mr. Harper,
Yes.
Ms. Michael,
Yes.
Kelsey,
Yes.
Ms. West,
Yes.
Mr. Moskin,
Yes.
Mr. Karas,
Yes.
Ms. Wood.
Yes.
That item is adopted. The next item on the agenda is ordinance number 2020-70.
An ordinance appropriating the sum of $2,992.94 for the city's unemployment liability obligation based on the notice of benefits paid by the state of Ohio and declaring an emergency.
This item is also sponsored by the Finance Director, Mr. Huff.
Yeah, so we do not appropriate these kind of funds for unemployment normally in our permanent budget. So as these come up each month, I'm going to ask for approval on them. I'm hoping that we can actually get some of these monies back with COVID funds when it all comes down to it. But for now, we just need to appropriate them as they come up.
Any questions for Mr. Huff on that? Do we have a motion to waive the 3 separate readings?
So move.
Second.
Mr. Harper,
Yes.
Mr. Moskin,
Yes.
Mr. Kelsey,
Yes.
Ms. West,
Yes.
Ms. Michael,
Uh-oh.
Mr. Karas,
Yes.
Ms. Wood,
Yes.
And do we have a motion to adopt the emergency clause?
So moved.
Second.
Ms. West,
Yes.
Mr. Moskin,
Yes.
Mr. Kelsey,
Yes.
Ms. Michael,
Is this still on 2020-70?
yes.
Okay, yes.
Mr. Karas,
Yes.
Ms. Wood,
Yes.
Mr. Harper.
Yes.
And then finally, a motion to pass the ordinance.
Moved, Calfee.
Second.
Mr. Kelsey,
Yes.
Ms. West,
Yes.
Mr. Moskin,
Yes.
Ms. Michael,
Yes.
Mr. Karas,
Yes.
Ms. Wood,
Yes.
Mr. Harper.
Yes.
Thank you. That ordinance is adopted. The next item on the agenda is ordinance number 2020-71.
An ordinance adopting the 2021 tax budget for the city of Ravenna and declaring an emergency.
And this is also sponsored by Mr. Huff, our Finance Director.
Okay, so I think we've talked about this one in committee. I haven't received any additional questions other than what we've already discussed. So at this point, I think we pretty much have it ready to go. So I'd like to propose an ordinance on this one.
Yeah, I'd like to just thank our new finance director for providing the detail in a machine readable format.
You're welcome.
It was a lot easier perusing through the different line items this way, and searching for things was a lot easier. So I appreciate that.
Okay, good. That's good to hear.
Well, if there's no questions for Mr. Huff, then is there a motion to waive the 3 separate readings?
So moved.
Yes.
Karas,
Second.
Mr. Karas,
Yes.
Ms. Michael,
Yes.
Mr. Kelsey,
Yes.
Ms. West,
Yes.
Mr. Moskin,
Yes.
Wood,
Yes.
Mr. Harper.
Yes.
do we have a motion to accept the emergency clause?
So move.
Second.
Second.
Ms. Wood,
Yes.
Mr. Moskin,
Yes.
Mr. Kelsey,
Yes.
Ms. West,
Yes.
Ms. Michael,
Yes.
Mr. Karas,
Yes.
Mr. Harper.
Yes.
And now do we have a motion to pass the ordinance?
So move.
Second.
Mr. Harper,
Yes.
Mr. Moskin,
Yes.
Mr. Kelsey,
Yes.
Ms. West,
Yes.
Ms. Michael,
Yes.
Mr. Karas,
Yes.
Ms. Wood.
Yes.
Okay, that item is adopted. The next item on the agenda is ordinance number 2020-72.
An ordinance amending ordinance 2020-053, section 1 by reducing the appropriation to line item 212.212.55954 from $200,000 to $120,000 and declaring an emergency.
And this is also sponsored by Mr. Huff, our finance director.
Okay, yes, and I think we talked about this one at committee last time. I did talk to Mike Bogo at NDS, and we only have the capacity for the 200,000 in total. And I think that from what he said and talking to him, that's going to be enough for this fund. That covers everything that we need to cover. There's been no additional expenditures this year. The 200,000 is all inclusive, not in addition to the 80,000 that was already in the permanent budget.
Any questions for Mr. Huff on this? Thank you. Do we have a motion to waive the 3 separate readings then?
So move.
Second.
Ms. Wood,
Yes.
Mr. Moskin,
Yes.
Mr. Kelfie,
Yes.
Ms. West,
Yes.
Ms. Michael,
Yes.
Mr. Karas,
Yes.
Mr. Harper.
Yes.
And do we have a motion to adopt the emergency clause?
So moved.
Second.
Mr. Harper,
Yes.
Mr. Moskin,
Yes.
Mr. Kelfie,
Yes.
Ms. West,
Yes.
Ms. Michael,
Yes.
Mr. Karas,
Yes.
Ms. Wood.
Yes.
And finally, do we have a motion to pass the ordinance?
So moved.
Second.
Ms. Michael,
Yes.
Ms. West,
Yes.
Mr. Kelfie,
Yes.
Mr. Moskin,
Yes.
Mr. Karas,
Yes.
Ms. Wood,
Yes.
Mr. Harper.
Yes.
That ordinance is adopted. The next item on the agenda is ordinance number 2020-73.
An ordinance authorizing the mayor and/or his designee to apply for and accept Federal CARES Act coronavirus relief funding to Ohio communities for COVID-19 related expenses and declaring an emergency.
This is also sponsored by Mr. Huff, finance director.
Well, I'm quiet the whole time, and then at the end I get like everything, huh? Sandbag. Oh boy. So this one, a lot of confusion, a lot of going on with this, but cities across the state are all approving the same ordinance. It's based on sample language. Chelsea worked with the law director to help, finagle it to be exactly what it needs to be. Right now, our funds are sitting at Portage County. The money came from the feds, went to the state to the county. Now the county is holding, it's $333,711.73 for the city of Ravenna. And once we pass this ordinance and the next ordinance, and we send that over to the county, they're supposed to get it to us within 7 days. At that point, then we gonna have to have some internal meetings, try to figure out exactly what we can spend this money on, what we cannot. Some of it's clear, some of it's not. You guys probably read the newspaper article on it. But for now, we just need to receive this money, we have to pass this ordinance and send it to the county.
I know I had some questions I'm not too sure you have answers to yet, but
Probably not.
questions on this specifically? Do we have a motion to waive the 3 separate readings?
So moved.
Second.
Ms. Michael,
Yes.
Ms. Wood,
Yes.
Mr. Kelfie,
Yes.
Ms. West,
Yes.
Mr. Moskin,
Yes.
Mr. Karas,
Yes.
Mr. Michael. Sorry, Mr. Mr. Harper.
Yes.
And do we have a motion to adopt the emergency clause?
So
I heard
moved.
Karas move.
Ms. Wood,
Yes.
Ms. West,
Yes.
Mr. Kelfie,
Yes.
Mr. Moskin,
Yes.
Ms. Michael,
Yes.
Mr. Karas,
Yes.
Mr. Harper.
Yes.
And then do we have a motion to pass the ordinance?
So moved.
Second.
Mr. Harper,
Yes.
Mr. Moskin,
Yes.
Mr. Kelly,
Yes.
Ms. West,
Yes.
Ms. Michael,
Yes.
Mr. Karas,
Yes.
Ms. Wood.
Yes.
Okay, that ordinance is adopted. The final ordinance tonight is ordinance number 2020-74.
An ordinance establishing a special revenue fund titled Local Coronavirus Relief Fund 201 and declaring an emergency.
This is also sponsored by Mr. Huff.
Right, so this relates to the ordinance 73 above, the same dollar amount that we're talking about. The state auditors have recommended us to establish a fund to account for all this funding. I chose 201 because it's a special revenue fund and our 200 series is special revenue fund. So this will just be used to accumulate all the revenue and the expenses coming out of it. Anything we don't spend will have to get returned back to the county.
Any questions for Mr. Huff on this? This is probably the beginning of the conversation with what the money can be spent on and whatnot. So I'm sure there'll be updates coming soon, but if there's no questions, is there a motion to waive the 3 separate readings tonight?
So moved.
Second.
Ms. Michael,
Yes.
Mr. Moskin,
Yes.
Mr. Kelly,
Yes.
Ms. West,
Yes.
Mr. Karas,
Yes.
Ms. Wood,
Yes.
Mr. Harper.
Yes.
And do we have a motion to adopt the emergency clause?
Yes, so moved.
Some second.
Mr. Moskin,
Yes.
Ms. Michael,
Yes.
Mr. Kelly,
Yes.
Ms. West,
Yes.
Mr. Karas,
Yes.
Ms. Wood,
Yes.
Mr. Harper.
Yes.
And do we have a motion to pass the ordinance?
So moved.
Second.
Ms. Michael,
Yes.
Mr. Kelly,
Yes.
Ms. West,
Yes.
Mr. Moskin,
Yes.
Mr. Karas,
Yes.
Ms. Wood,
Yes.
Mr. Harper.
Yes.
All right, and that ordinance is adopted. Tonight, we don't have anything on second or third readings. Is there any old or new business to come before council?
Go ahead. Sorry. It's hard to tell who's talking with this. So I apologize if I didn't mean to cut you off, Dr. Calfee. Go
No,
ahead first.
that's okay. As we approved tonight, the camera for the meetings that we were going to have, it made me think if we should look at making the installation of that part of a larger plan to have some type of display board or monitor in the city council chambers. When we have a presentation, many times, you know, the only way we can follow it is on our computer, or if we had some type of display that was in council chambers that both we could look at and anybody that's attending the meeting. I don't know if it's the time to address it now, but just the thought as we're installing things up on the wall, if we want to look at something that we have that display on. Just a thought. I don't know what the plans are in the future for that.
Yeah, and I think that's a conversation for IT possibly. And that was one of the questions I was going to ask Mr. Huff as we just created those 2 funds. You know, maybe that's a committee meeting discussion on what I think we're nailing down what we can spend those funds on, because that might include or could include, I don't want to, maybe might is too strong of a word, but it could include something like that, a display, because we certainly have the room, the wall space here to have some of that. We were just discussing, I'm looking at the projector, which is behind the audience, which is always difficult if there are, to your point, Mr. Calfee, presentations in council chambers. It's difficult to follow along because they're so far away. So yeah, I think that's a worthy discussion for committee, certainly.
Someone talking? Sorry.
Cheryl was making a comment.
Okay, go ahead, Cheryl. Sorry.
No, I was just saying I agree that that would be a nice feature
Okay.
to have in there for future meetings, and especially with the video. And there might even be a way, I don't know, whether it's a whiteboard that's connected directly into our computer system or something, so that whoever's running the meeting in there could control stuff and put it out there, even on the YouTube and meeting feeds for everyone to see.
Something I wanted to bring up as far as new business, just to let council know that may not know, we have something going on in our downtown that is not sure where. I'm trying to think the best way to put it. We have newly developed a homeless problem that's become a little bit different than it's been maybe in the past. I don't know, like last summer, it's a little different. We have had some new people that have come into town. We're not sure really where they could be coming from, how they got to Ravenna. I've had some complaints from some of the merchants that they are doing some things that would not be considered appropriate in public. They are using a local attorney's electric outlet that they have in front of their home or their business that they are using to plug their cell phones up, and then they are camping out in that area. I know our police have been involved. We also, they're starting to go to the movie theater and sleep. And, you know, our area isn't really accustomed to seeing this as much as it's been lately. So it's kind of, it's not uncommon that this can happen, but we do have somebody that the mental health board is paying to be in our downtown. And so we've been trying to get some communication from her and finding out, you know, what's the story, why, you know, what do the people need, how did they end up here. The problem they're having with one of the individuals is she has a couple of pets that have been her family, and she will not abandon her pets. So, and I respect that, but it's causing problems for her to get housing. We are trying to look at solutions and ways to help our merchants, because, you know, we did put these tables outside, and so a lot of them are approaching people that are outside eating. And that was a concern that I had mentioned in the beginning, when Main Street wanted to put these tables around all different places, who would be monitoring this? The businesses that have them out there are doing their job of trying to monitor, but unfortunately, we are having patrons and people that are out there trying to enjoy their dinner be panhandled. So for my committee meeting next week, this is one of the big topics that that we need to, you know, figure out, you know, to maybe possibly create an ordinance for panhandling, or what loitering is in our community, because there's not a lot of enforcement we can do with people that are considered loitering. What is the definition of loitering? So, you know, we just got a lot of different things going on, and, you know, we want people to feel safe coming in our downtown, to be able to go outside and eat. We want to continue to help our businesses. We don't want people to be afraid. And, you know, we're looking at solutions that, you know, ideas that we can make some of these problems go away. So I'm hoping that the business owner who has the electrical outlet is supposed to be covering that up. At this point, it has not been done to my knowledge. I did receive a phone call over the weekend that it was still going on. So there's a lot of different things happening. So I just want to make all of you aware of it in case you've heard anything, or, you know, you get a phone call. It's kind of something that's started up.
Is there any
That's all.
other, yeah, thanks, Amy. Was there any other old or new business tonight? And if not, Mayor, do you have any remarks tonight?
Just a few. Just for your information, I talked with the folks out at Mongoose today, and we both agreed we cannot do the car show this year and be able to meet any of the standards that are being set by the state with that. I'm afraid the same fate is going to affect the balloon fair, which presently they've talked about having it. Unless they change the rules this week, the Board of Health is not going to allow that. And of course, they can control that because a lot of the vendors have to get temporary permits to sell food. I want to remind everybody that the census is still underway. They're having a hard time getting things settled with this, but if you know of anybody, they can go online and do it very easily. And that's to our advantage to have everybody in Ravenna County. We've had a couple of demonstrations on the courthouse lawn with supporting the Black Lives Matter movement. They've been very peaceful, and a lot of young people attending these, both black and white. The pandemic still continues to dominate our life, but you've heard most of that already from the health department. But we deal with these problems every day that come from this. Tomorrow evening, the Planning Commission will be looking at Menard's first site plan for the possible building a place on the property out on Route 88. Council will be involved with this. It's going to have to be adjustment in the riparian rights out there, and we will be bringing that recommendation to the committee meeting in council. This is another one of those issues that is going to be time sensitive, and it might require a special meeting the Menards has invested a lot of time and money into developing this site and taking a look at it. But up to this point, they have not purchased any property. And this is something that can go on or it may not yet. I don't count it for real until they start buying the property. But this is a big step. The meeting tomorrow night is a big step. With that, Mr. Cole has worked with this group and shown them a number of places, and this is the one that they'd like to end up on, at least according to him and some other people that have been looking. A lot of the issues have been covered by council people tonight, other issues that we've been dealing with. Whenever we get this hot weather, that's when you start seeing about the breakage of water lines. It seems cold weather, real cold weather, and real hot weather seems to stress the old pipes, and they give way on occasion. So hopefully we don't have a lot of that at this time. I will stop there, Mr. Kluge. Unless anybody has any questions.
Mayor, what's the deal with the meeting, the planning commission meeting? Is it online? Is it in person? I didn't see it on the website.
Yes, it will be televised tomorrow night. You guys are the experiment to see if this works so that we can use it tomorrow night, because it has to work tomorrow night. The Menard people will be calling in. I expect to have most of the planning commission present with the proper distance in the room in there. And we've already held one meeting like that with that particular group. And so that's the issue with that. I would assume that if you want to drop in on that or want to be able to get access to it, you would have to do it silently. The riparian issue will not be discussed tomorrow night as part of the site plan. But that will be coming, but it's not a public hearing or an open forum for everybody.
If I can just add real quick, Mayor, it'll be on, my understanding, correct me if I'm wrong, on the council YouTube channel. It'll be streamed there. So
Okay.
if you'd like to tune in, that's
No more about that tonight. Been a lot of effort going into this. Mr. West has worked very hard on this project, along with other things that he's done. We're hopeful that this comes to fruition. It would help offset if they maintain their 90 jobs prospect. It would maintain some of the jobs that have been lost in some of the surrounding businesses that use the pandemic to streamline their companies, and they cut back on that lot.
all right. Well, any other questions? Hearing none, then I will adjourn our meeting tonight until Monday, August 3rd. So, thank you.